Bon matin. Bienvenue à la réunion du plénier du mois du 8 février 2023. Bonjour aux membres du conseil. Bonjour, M. Parisien, chef de département, les gens dans la salle. Bon matin. On part avec l'ouverture de la réunion. Item numéro 2, déclaration d'intérêt pécuniaire. Aucune. Ça va à l'adoption de l'ordre du jour à l'item numéro 3. Il faudra ajouter, avant d'adopter, l'item numéro 4.2 à l'agenda concernant une présentation du directeur général, M. Beauchemin, de l'hôpital général de Hawkesbury. Donc, ça sera rajouté à l'agenda pour un proposeur, un appuyeur. M. Leroux, appuyé de M. Laviolette. Tous en faveur? Ceux qui sont contre, adopté. On s'en va à l'item numéro 4, pétition, délégation et présentation. 4.1, Conseil des arts de Prescott-Russell, Heart Council, Caprac, demande de financement. On a 3 dames dans la salle, donc Mme Margot Malbeuf, qui est directrice générale de Caprac. Mme Malbeuf, veuillez prendre le podium, s'il vous plaît. Alors, M. Parisien, avant, 2 petites secondes.
Oui, M. le Président, membre du Conseil, si vous me permettez, juste pour mettre un peu de contexte, 30 secondes. Vous avez vu la demande de financement de Caprac qui est de l'ordre de 150 000 $ pour 2023. Faites à noter que lors des discussions budgétaires, on a prévu une somme de 100 000 $, ce qui était versé au cours des 4 dernières années lors du mandat précédent pour l'organisme. Donc, il y a un écart entre la demande puis ce qu'il y a au budget. Donc, c'est juste pour vous mettre ça entre les oreilles avant qu'on commence. Merci, M. le Président.
Merci, M. Parisien. Mme Malbeuf.
I'm nervous. I'm going to read my notes, okay? Hello, council members of the United Counties of Prescott and Russell. My name is Margot Malbeuf. I am here representing the Conseil des Arts de Prescott-Russell. Here with me today are our organization's president and of the board of directors, Lynn Labrec, and board member and treasurer, Tina Petrovich. We're presenting today our operational funding proposal. Le Conseil des arts est le représentant culturel des comtés unis de Prescott et Russell. Notre mission consiste à informer la collectivité des diverses manifestations culturelles, artistiques et patrimoniales de la région, de rassembler les acteurs culturels, artistiques et patrimoniaux, d'accompagner la réalisation d'initiatives rassembleuses et de promouvoir les arts, la culture et le patrimoine de la région de Prescott et Russell. Nous sommes un organisme à but non lucratif et depuis 2014, le CAPRAC est entièrement financé de manière opérationnelle par les comtés unis de Prescott et Russell. Le CAPRAC est le carrefour de tout ce qui concerne les arts, la culture et le patrimoine dans la région. Nous desservons les 8 municipalités représentées par le CUPR. Chacune des municipalités représentées a ses propres caractéristiques uniques, mais elles sont tous unies par leur tradition, leur patrimoine et leur objectif commun de travailler à la prospérité de tous leurs résidents. Présentement, nous représentons ces 5 centres culturels renommés de notre région, avec la possibilité d'en ajouter d'autres dans l'année à venir grâce à notre nouveau site web organisationnel. Le CAPRAC présente aujourd'hui une demande de financement opérationnel pour le montant de 150 000 $ plus 3 % d'ajustement à l'inflation annuellement pour un terme de 3 années consécutives. Nous demandons que ce financement commence rétroactivement de janvier 2023 et se prolonge jusqu'à la fin de l'année 2025. Ce financement permettra à notre organisme de poursuivre ses activités quotidiennes, de chercher des fonds provinciaux additionnels et d'accroître nos niveaux de service afin de répondre aux besoins de nos partenaires communautaires et municipaux ainsi qu'à ceux à nos membres. In contrast to regional galleries, cultural centers, and heritage sites, CAPRAC acts as an umbrella organization supporting and promoting all sectors of arts, culture, and heritage, individuals and organizations alike. To support and promote the sector, CAPRAC responds to the needs of the sector individually or as a group, offers consulting services and assistance with research and development for specific projects, CAPRAC maintains and builds a database of tips, tools, and resources to share with our members and partners. CAPRAC maintains operational databases of our audience and usage based on region and socioeconomic status, among others. CAPRAC networks with other councils and organizations in Ontario to create broader opportunities and gain additional resources. CAPRAC creates, supports, and promotes events and activities across all regions of the United Counties. CAPRAC advocates for, seeks, and disseminates paid opportunities for regional artists and works to preserve our cultural heritage. Here are some recognizable projects which may not have been possible without the support of an organization like CAPRAC. The Pop Silo across the counties, the Parc Latz in Embrun and Russell, the Édition David Raconter l'Est Ontarien, a book published to feature local francophone authors, Au la Vache, the Painted Cows Initiative in collaboration with Festival de la Curde in Saint-Albert, and the Fresque de la Diversité Culturelle, administered by ACFO and supported by CAPRAC in Hawkesbury. Le CAPRAC a un impact direct sur les municipalités des comtés unis. Ceci étant dit, CAPRAC assiste au développement et l'administration d'initiatives artistiques et culturelles spécifiques dans chaque municipalité. CAPRAC assiste à la recherche de financement additionnel pour de nouveaux projets grâce à notre expertise, notre soutien ou notre partenariat. Comme par exemple, en 2022, la municipalité de Castleman a pu accéder à près de 50 000 $ en partie grâce à notre aide en matière de recherche, de développement et de soutien. Le CAPRAC a été nommé partenaire intégral dans cette subvention. CAPRAC utilise notre réseau pour obtenir les ressources nécessaires, par exemple des avocats spécialisés en droit d'auteur, des barèmes d'honoraires recommandés pour les artistes professionnels et autres. CAPRAC améliore le profil de la région en cultivant des communautés culturellement riches, contribuant au bien-être de la population. Et CAPRAC réduit le sens d'isolement de nos zones rurales en connectant et informant les citoyens de divers événements et initiatives artistiques, culturelles et patrimoniaux. These are some photos of CAPRAC activities in the counties. One of our many pop-up markets, 150 Reasons to be Canadian, showcase and exhibition. Part of our Culture Days activities, En Vedette, showcasing local talent. An activity at Boisé Est, Wood and Forest Exhibition, and Art sur la Rive Symposium. Funding requested will be allotted for operational funding, including retaining current employees and adding one additional staff, maintaining the online CAPRAC Gallery site, which offers artist members opportunities for sales, continuing to be accessible through our Pay What You Can model for membership, and offering free community engagement programming, diversifying our reach through our work with Réseau de soutien à l'immigration francophone de l'Est Ontario and Association canadienne française de l'Ontario, extending our reach through our social media networks and events, and through the CAPRAC newsletter, continuing to provide news of relevant events and activities to the public through our new online tools, including a digital events calendar and interactive map, supporting individual projects, utilizing a network of related professionals, working to increase the level of professional development of our membership, maintaining and developing relationships with supporting businesses like Scrap en Masse, KB Media, and Dessert. Additionally, funding will be used for the management of additional grants, for which 2 applications have already been submitted and are currently under review. The Summer Jobs Grant for $8,300 through Employment Canada, the Resilient Communities Fund offered through Ontario Trillium Foundation for $42,200. And we also plan on applying for a Community Services Recovery Fund for an additional $50,000 from a federal grant to collaborate with our cultural nonprofit partners to access a shared need for training, for continuity planning, and to build future resilience. Finally, funding will be used to fulfill our current obligations to continue work on several ongoing projects. For example, a public art installation with the municipality of Castleman, a series of artistic workshops with the municipality of Clarence-Rockland, and to continue enhancing our digital outreach with our organization's new website. Further, CAPRAC will continue to apply for relevant grants to engage and expand the reach of arts, culture, and heritage projects, events, and activities. On a related note, our organization is currently debt-free, only cautiously retaining a minimal reserve fund to continue essential operations while awaiting funding from the United Counties. By the end of this month, we will have approximately $1,800 in our organizational account. We recently sent out a survey through our social media networks asking for support from our communities. Between then and now, we've collected it's been up to 179 responses showing support for our organization and the work that we do. CAPRAC was created out of a demonstrated community need for artistic, cultural, and heritage-related services and programming in the region. As partners with United Counties, CAPRAC has consistently delivered on its commitments and as an organization met or exceeded expectations year after year. CAPRAC would not and will not exist without our partners at the United Counties. This is it, the last one. We thank you for your past and continued support for the arts, culture, and heritage of your region. Merci.
Merci beaucoup, Mme Malbeuf. À ce moment-ci, je demanderai aux membres du Conseil s'ils ont des questions pour Mme Malbeuf. Any questions for Mrs. Malbeuf? Monsieur Lefebvre.
Merci, M. Parisien, et merci, M. Parisien, encore pour avoir donné cette petite entrée discours pour donner tout en contexte des choses. Je veux dire, j'apprécie ça. Et bonjour, good morning. I just have a question for you, basically, because for my general understanding, because if I look at your budget, I see very clearly that the majority of the sources of revenue for your operations are coming from the United Counties of Prescott-Russell.
Yes.
So is it the fact that you are an umbrella organization, you're not eligible for other types of grant, and your grants are mainly for activities and not for administrative purposes?
That's right. Yeah, the grants that we are able to go after are project specifics. For example, we just finished a new website and we had received a grant for that project.
Okay.
Yeah.
So the fact that your organization is an umbrella or another structure administratively is not necessarily eligible for funding per se.
I'll maybe let our treasurer speak a bit more to that point.
Are you talking about additional fundings from other sources? Sorry.
I'm just looking at the structure of your organization, because it was mentioned that you are an umbrella, so
Yes.
you're basically sponsoring various activities or helping various activities for funding purposes. So you're mainly an administrative structure, if I can understand it, because you're being entirely funded by the United Counties, or in large part by United Counties of Prescott-Russell. Therefore, maybe you're not eligible because you don't actually organize an activity, but you promote it in another sense. I'm just trying to understand.
Okay, so we do.
Structure.
Okay, so we do a number of functions. We do some activity-based things, which does allow us to projects, which does allow us to approach bodies like the Trillium Foundation for monies. In the case of actually the recent grant that we had was actually a COVID recovery. It was an operational grant because it allowed us to build a new website, and it allowed for staffing. But otherwise, because of the kind of services that we provide, it doesn't allow us to seek other funding.
Okay, thank you. That was what I was looking for in
yeah.
terms of response, because I was looking at your budget, but I see Mr. Parisien also has maybe a comment. So thank you again for responding to my question.
Okay.
Merci, M. Lefebvre. M. Parisien.
Oui, Monsieur le Président, merci, membres du Conseil. Just to give you a bit of historical background. In 2014, Monsieur Charlebois, who was the head of department for ECDEV at the time, put in place, we actually created Le CAPRAC. And the organization had its own chart, its own body, and incorporated. And we started to fund them roughly, I'm going to say, at $50,000 a year at the time, and that amount went up to $100,000 last mandate. But it's been in place since 2014. So we have been the main funding partner from the get-go.
Merci, M. Parisien. I could see your head shake at the back. What was the reason for the head shaking?
I'm sorry, it's just that the numbers aren't right. We were actually started at $100,000 from the county, and that was in 2014. The funding model was then for progressively that the amount did go down for a period, and then starting in 2019, the amount went up for 100 to 100,000. And so for the last 5 years, we've been trying to run the budget with $100,000, but I am going to say that what $100,000 got you 5 years ago, you can all imagine in terms of wages or rent or all of those things, does not get you the same amount now. And so that is part of the reason for the larger demand of like 150, because quite frankly, it meant that we have lost our 2 EDs in the last 5 years because of that funding model. We couldn't supply those wages, and now we have a coordinator. Although Margot, we're very happy to have Margot. We can't afford to pay ED salaries. So that I just wanted to just clarify that they're
Okay.
what the actual numbers are.
Thank you. Monsieur Leroux.
Merci, Monsieur le Président. I think, obviously, arts and culture is very important as a community. I do see in the report, very detailed report, so thank you very much. I do appreciate that. I see, though, even within your own membership, there seems to be struggles. I see you indicating member communication. You're sending out, over 400 emails to members, and roughly 35% of them are even opening the emails. So I think there's challenges from an organizational point of view that your membership doesn't seem to be very engaged with the organization itself. So I think from that perspective, I understand that money doesn't go as far as it did 5 years ago. That being said, you're looking for a 50% increase, significant amount, right?
Yeah.
And I get that. I think, is there opportunities from a county perspective of getting more return on your investment? I think there's possibly of having opportunities out there. I believe one of the programs we used to do with another organization has fallen back to us at the county level, if it's possibility of finding a new partner for that. One thing I will mention, though, that I find that could be an opportunity is that I know that in our own municipality, one of the things we've been asked by our local organizations is to create a calendar where organization can put all their events. This seems to be what you guys are working on.
We have it.
Right. So that might be an opportunity, with the additional funding from us, that you provide this service to all the municipalities. So all the organizations can, so that way I click in what's going on in Russell Township, what's going on in Nation Township, what's going on in Castleman. Our residents could, and not necessarily us doing it each and spending money each at our local organization. That might be something you want to look at and see if that's a possibility. But, I'm just throwing it out there.
I'll give you a chance to reply back. Now, if you want.
Okay, sorry, I'm not used to this kind of formal. Thank you for the comment. So I just want to comment on that is that the new website that we built with the funds from the Ontario Petroleum Foundation. One of the things that we saw that was missing was that calendar of events, as well as an interactive map that helps people place where those events are happening. And it's available now. Like, we don't have to develop it; we have it. So it would be as simple as the service that we could offer to the municipalities is that you could simply have a link that would just jump right to our calendar, and that's something that the only problem is that right now is just it's just brand new. We launched the site you were there, thank you for attending, in November. So it just, of course, it's been a busy time of year, so it's just reaching out to everybody and making sure that everybody understands that it's available.
Thank you. Follow up, Monsieur Leroux?
Yeah, thank you very much. I think what I'm imagining would be that organizations would have the ability to you're right. So the Club Optimiste would go somehow through a back door to your website to say, this is what we have going on for
Yeah.
the next month.
Yeah, it actually isn't even like they don't even have to do a backdoor. It's a click right on the site, right where the calendar is. It leads them to a form. They fill it out, and then all it is then we take a look at it and make sure that it isn't something that's not how can I say. We yeah, it's not a Tupperware party or something that's not, appropriate to that site. And it's automatically, we just click a button and we approve it and it's uploaded.
Thank you very much.
Merci, M. Leroux. Madame, M. Parisien avant, puis après ça, M. Brière.
Monsieur le Président, membres du Conseil, I don't think, by the time that we adopted our budget, by the time we received the funding request from CAPRAC, a few months have elapsed, so we put $100,000 in there because that's what we've given out in the last few years. Given also the rising costs of everything, I don't think that the request from CAPRAC is unreasonable. Is $150,000 the right number? I don't know. What I'm offering is, and I'm aware that they're in a bit of a bind right now. They have no debt, but cash flow is kind of limited and low. So I think that what needs to be expedited is at least flowing some money to them so that they can breathe for the next few months. But I've got a few ideas which I've shared with the Treasurer yesterday, and I think these are some things that need to be looked at. I know they're leasing space, and I'm not putting this in stone, but given the work from home situation that we're having at the counties right now, we've got some space that's available. So possibly we could look at, I'm just speaking for the sake of speaking, providing space at a very low cost would be an option. The other one is that we're presently revamping our active department, and therefore on doit trouver des solutions pour faire des choses autrement. On a dans notre portfolio la gestion des pancartes bleues. Ça, c'est ce que vous voyez le long des routes de comté puis des routes municipales qui annoncent des commerces ou des choses pour notre développement puis pour notre marketing. Donc ça, ça devient pour nous quelque chose d'un petit peu plus complexe à gérer. Bien que nos employés des travaux publics font l'installation de ces panneaux-là, il y a quand même une gestion qui doit être faite de ces panneaux-là. Puis je dois vous dire qu'on n'a pas à ce point-ci l'ensemble ou le répertoire de toutes ces enseignes-là, quelles doivent être changées, à quelle fréquence, est-ce que c'est 20, 25? Donc, on a eu des discussions préliminaires avec le CAPRAC, puis on aimerait, si possible, regarder la possibilité de faire la gestion de ces pancartes-là, les enseignes bleues, avec le CAPRAC. Donc, on aimerait pouvoir s'asseoir avec eux puis voir si c'est possible pour eux de le faire pour nous, moyennant une somme qui est maintenant prévue à notre budget, mais qu'on ne ferait pas nous-mêmes. Donc, il y a peut-être une occasion pour nous de développer quelque chose avec eux et puis nous donner le temps, en fait, de s'asseoir puis de voir si c'est possible. Mais je pense qu'aujourd'hui, la raison pour laquelle on a précipité la demande, c'est qu'ils ont besoin d'argent. Et ils ont besoin d'argent pour être capables de se rendre au prochain mois. Donc, je ne sais pas si le Conseil est prêt à donner un montant qui sera révisé dans quelques semaines ou dans un mois. Mais moi, j'offre ça comme étant peut-être une piste de solution pour sortir d'une impasse.
Merci, M. Parisien. M. Brière.
Good morning. So what is your current membership at, and what are some of the advantages of being a member?
Thank you. So we currently have 82 members. They register with the pay what you can model. Some of them pay more, some of them pay less. And I do have a list in the report. But they get to put in their own personal events into our events calendar. They get to come to us for support if they're looking for, okay, I have this project, I'm looking for money. So we kind of offer them support, like professional support in that way. Among other things. But we also are partners with the municipalities and the nonprofits in the sector, so they're also supported by us.
My follow-up question is, as a member, I see the advantages. I would want to pay to be part of that, right? Mm-hmm. So the pay-as-you-go thing may be something you need to revise and
yeah. So we had
have them participate a little bit more in the administration of the committee, you know. What you do is worth it. So as a member, I'd be willing to pay for the services you provide. I suggest that maybe you don't give it out for free, and then you'll really see how people are, how involved they are, you know.
Yeah.
So that's just my comment, and because the pay as you go, nobody's going to offer up money for nothing. We don't live in a society where people tend to see that kind of stuff, you know.
Yeah.
So.
Thank you. We did switch to pay-as-you-can during COVID because we were offering much less exposure, less services and things, and we did find that the 2 years that we offered the pay-as-you-can model, we did actually bring in more money than before. So people are acknowledging the value that we have and understand that we're a not-for-profit, and we did had like several people did do the pay-as-you-can model, and they provided even double what they were paying before. So we have found that we've brought in more revenue from the pay-as-you-can model. Yeah.
Merci, M. Brière. Madame Lajoie.
Hi, thank you for your presentation today. I'm just curious, I know you have a partnership with Maison des Arts and your partnerships with other organizations. How does that work exactly?
Right. So
like,
the
how do you
cultural
support them?
Thank you. The cultural partners that we have, so we have, they're very visible on our new website. They can go click on kind of a profile about them and follow to their own websites. The non-for-profit cultural partners, we support them in the same way. Similarly, we can apply for grants with them. We're working on one where we as an umbrella can support the cultural partners as well, like apply for money for training and funding and things like that we could be disseminating to them as well. And we offer an in-kind membership, so they don't need to pay to be a member with CAPRAC, but they can like use the facility, the services that we offer, the calendar, like I said. Is there anything that you want to add to that?
Yeah, like I would say that one of the things that, sorry, I keep forgetting, sorry. One of the things that we were able to offer during COVID, because Margot, is new to our organization, is that there was programming that the different organizations, in order to keep themselves engaged with their community, because during closures, is that we were able to reach their audiences and help them disseminate the different virtual programming that they were doing, so that they could maintain, like Maison des Arts, they had a number of virtual dance classes that they were running, and we were able to help them do that digital switch and reach their audiences.
Thank you, Madame Lajoie. Monsieur Leroux, you follow-up? Go ahead. Sorry.
My follow-up is more of a comment than a question. My son he has Asperger's, or he's autistic, and in our little municipalities, a lot of the activities that children can play are sports related, and my son, not being a kind of sports related kind of boy, really benefited from the art program at Maison des Arts. Sorry, thank you. So that was very distracting. So I see the value in your work, and looking at your strategic plan, number 4 is to build up the next generation. Youth, board members, training in schools is valuable. Working in schools in Ottawa, we had a lot of access to arts programs and workshops that would come in, and we don't have access to that kind of service in our municipalities. So the fact that you offer that other option outside of the sports realm, I think is incredibly valuable, and your work with the pop silos and the cows are really great for tourism and trying to build scavenger hunts. So I just want to say that I appreciate all your hard work that you've done. And thank you for promoting arts in our municipalities. It's very important.
Merci, Madame Lajoie. Thank you. Monsieur Leroux? Question?
Pas de question, just to move the discussion along. I would suggest that we move forward with the $100,000 that we normally give them, so you can have some money right away to get your operations rolling, and that Monsieur Parisien can work with his team and discussions with CAPRAC and come back at a later date to further discuss the additional $50,000.
Proposition, M. Leroux, un appuyeur. M. Brière. Commentaire, M. Parisien?
Monsieur le Président, membre du Conseil, ma question c'est pour Mme Parisien. Mme Parisien, how do we flow the money to CAPRAC? Is it quarterly, normally?
Monsieur le Président, membre du Conseil, oui.
Merci. I'm just thinking ahead here because we already have at least a month into the year, and we're almost 1.5 months if 25 is going to be sufficient. So I just would like to have some latitude from council possibly, or come back, let's say in 2 weeks from now, to maybe defer from using the quarterly payment just to make sure they have enough to move the yardstick forward. So.
Je pense que ce serait le consensus des membres du Conseil de donner peut-être 50% pour partir, puis après ça, faire...
Mr. President, I'll be back in 2 weeks, but I mean, we can't normally flow money until you adopt the resolution. Today is Committee of the Whole, so the money would flow. That give us 2 weeks to find out how much they need and what do we need to flow right now.
Parfait. Madame Cadieux?
Comme M. Parisien a indiqué, on peut préciser tous les détails des transferts d'argent à la résolution dans 2 semaines, mais présentement, on aurait simplement besoin d'une directive du Conseil. Donc, on a une proposition pour un appuyeur du 100 000 $ pour commencer.
Donc, on a proposé un appuyeur. Est-ce qu'il y a d'autres questions? Moi, avant de passer au vote, j'aurais une question à mon tour. En caisse, en 2022, le 31 décembre, savez-vous combien vous avez à la banque à date? How much money you have in the bank in cash as of December 31st?
As of December 31st, I could tell you what we have right now in the account.
Okay, that's good.
Right now, what we have in the account is we have about $10,000. But at the end of this month, because of there's expenses that we have, subscriptions and wages and DAS and HST. Yeah, like what I said before is that we will have $1,300 in the account at the end of the month.
Okay, I just wanted to make sure that if you were sitting on 50,000, that you were still okay for a couple of months, but you're not sitting on 50,000.
No.
Very good.
No, we're not sitting on 50,000.
Good. All those in favor? An autre comment, Madame Lajoie?
I would just like to add to the proposal that we add that we're going to look at the 50,000. Okay, perfect. Just want to make sure. Perfect. Thanks.
That's in. So all those in favor? Against? Carried. Merci beaucoup. Thank you so much for the presentation and being with us this morning. Have a nice day. And you're more than welcome to stay throughout the meeting. On s'en va à 4.2, item number 4.2. On a sur l'agenda une présentation du directeur général, M. Beauchemin, de l'hôpital général de Hawkesbury. M. Beauchemin, le microphone est à vous.
Donc, bonjour. Merci, M. le Président. Merci, les membres du Conseil. Donc, je n'ai pas une présentation sur PowerPoint. J'espère que c'est la première présentation de beaucoup. La première chose que j'aimerais faire, j'aimerais remercier le Conseil, puis les maires. Moi, ça fait 5 mois que j'étais à la GH. Avant ça, j'étais à l'hôpital Ottawa pendant 16 ans de temps. Puis après ça, j'étais à l'hôpital Bruyère avant ça. Puis pour moi, il y a 2 choses que les gens m'ont dit dès le début. C'est certain que j'étais encore dans la période d'écoute. Ils m'ont dit 2 choses. 1, le projet là, de l'AGH n'est pas fini, de 1. Puis 2, la seule raison que l'AGH est là, donc c'était de l'hôpital d'Hawkesbury à l'hôpital régional AGH, qui est pour l'hôpital de Prescott-Russell, c'est à cause des 7 maires. Monsieur le Boutillier, le DG précédent me dit que essentiellement le financement est venu du gouvernement quand les 7 maires sont allés à Queen's Park, et essentiellement c'était les 7 maires ensemble qui ont fait la poussée pour la GH. Votre hôpital en ce moment a doublé en grosseur, donc essentiellement a 800 employés, a plus de 150 médecins. essentiellement compte 3 salles opératoires, puis il va en avoir 4 bientôt. Puis essentiellement, on offre tous les services qui ne sont pas tertiaires. On offre tous les services pour les citoyens de Prescott-Russell à l'AGH. Donc, ça veut dire que si tu as besoin d'un test, on a un CT scan, un MRI, on fait les chirurgies de jour, etc. Donc, ça, c'est le morceau de merci. Le morceau qui est pas terminé encore, c'est qu'on sait qu'on vit dans un système qui est en transition. On essaie de sortir de la pandémie. Vous avez su aussi qu'on a fermé l'urgence durant la période des fêtes à cause de plusieurs raisons. Donc, pour nous autres, c'est de voir là, c'est quoi la prochaine étape. So I'm gonna switch to English. Je vais aller en français puis en anglais. I'm here to sell you on a vision. Okay, so the next piece for Prescott-Russell. So look at your constituents, right, and look at where they access healthcare. Right now, your access to healthcare, you're lucky if you have a family physician. If you don't have a family physician, you're going to the emergency department. Your choices are, depending on where you live, you come to HGH, right? Maybe you go to Glengarry, doubtful, and you're probably going to Ottawa, right? The problem with that is that at the same times, all the hospitals have the same issues, right? So when HGH had to close its doors for a couple of days in December, well, essentially at the same time, the Ottawa Hospital had 40 admitted patients in the emergency department with 4 hours of offload delays, right? And Montfort was having the same issues, right? So essentially what we're looking at, and the vision I'm trying to sell you on, is that one, right, independent of where the residents live in Prescott-Russell, one, if they have a family physician, that family physician needs an access in terms of where to do their access to diagnostics, so for MRIs, CTs, X-rays, MRIs, etc. Right? The other piece as well is they need access to specialists without having to drive to either Montreal or Ottawa. Right? And like I said, I've worked 16 years at the Ottawa Hospital. I led regional programs. So there's a difference between a major center, a tertiary care center that specializes, and this is Montfort and the Ottawa Hospital, specializing in tertiary care, right, which is cancer care, major traumas, that's what they specialize in. They do not specialize in primary care. They do not specialize in secondary care, right? So me leading regional programs was very much from the Ottawa Hospital, leading what the Ottawa thought was good for the outlying areas, right? And from an Ottawa perspective, Prescott-Russell is an outlying area. So I led a lot of regional teams, but it was based on an Ottawa-centric view of how the world works. The vision I'm trying to sell you at this point is that we don't need that type of vision, right? We'll always need Montfort, we'll always need TOH for tertiary care, right? The model that I want you to think about, right, is a model where you have primary care. So your constituents have a family physician, right? The reality is a lot of your constituents do not have a family physician. So the next step after that is having some type of urgent care center or a center they can go to get their first level of care that's not in the emergency department, right? Because when they go to the emergency department, they're going to wait 14 hours. They're going to wait 24 hours. Why? Because it's not an emergency, right? Compared to the traumas that go into, and even at HGH, right? I mean, and you probably don't know this, our emergency department is busier than Cornwall's and is busier than Montfort's. So HGH emergency department is busier than Montfort's, right? The issue that we have is we don't have the same amount of beds to admit to. That's our issue, right? So again, going back to the vision, you have primary care, right? Or you have, if you don't have a primary care physician, you have an urgent care center, or you have a center where if your constituents need care, they can access those centers that are not in Ottawa, where I have to pay $14.50 for parking and then walk a kilometer to get to the clinic or to the emergency department. That's actually close. And at that point, if essentially they need further diagnostics, if they need X-rays, well, a lot of you have X-rays in your regions, right? They don't need HGH for that, right? But if they need CT, they need MRIs, they need any type of diagnostics, then there's a link specifically with HGH, right? And HGH in Hawkesbury, but also HGH, and that's the piece that I want to talk to you about, HGH outside of Hawkesbury, right? So then at that point, if then based on that you need a specialist, well then now you need to still go to Ottawa, you still need to go to Montreal. You can come to HGH because HGH with the 150 physicians that we have all the specialists we have specialists from Montfort and we have specialists from TOH that come and do clinics at HGH, right? So again, the pitch is that's great, right? But also, I think it needs to be, so that covers sort of the east side of Prescott-Russell, but we need something on the west side of Prescott-Russell, right, for that sort of first level in terms of I'm accessing healthcare, I need diagnostics, ooh, there's something wrong with me, I need to see a specialist, right? And after that, right, the link that you have is that you have primary care, you have the specialist, right? And then if it's day surgery, well, again, you shouldn't have to go to Ottawa for that. Then for surgery, you come to HGH, right? And if after that you require tertiary care, then you have those linkages with Montfort and TOH, which your constituents already have, right? So it's about providing the care at the right place at the right time, right? So essentially for me, what I'm here to do is that, we built HGH together, right? And I go back on that it took the 7 mayors to push it through, right? The next phase of HGH, and HGH has some money, right? We're gonna have to fundraise, we're gonna have to do that. But for those of you that were around at the time, there was a functional plan that was built to build, at a first phase, build a hub in Castleman, right? That would have, and I wasn't there at the time, so I'm just gonna go through, that would house mental health and addiction services, would house community clinical programs, some of our programs that are in Hawkesbury that we would split between both, so we can service the east side of Prescott-Russell and also the west side of Prescott-Russell. I think we had discussed emergency services for Prescott-Russell, the Canadian Mental Health Association, the Alzheimer's Society. So that's what was already discussed in the plans, and it was costed out, right? It was costed out at pre-pandemic prices, right? We know that post-pandemic prices are very different. But for me, what's changed is that, so I'm coming back in terms of that first initial saying, we had a board retreat last week with the HGH board, and essentially the push from myself and our team was to let's get back on track and let's continue the growth of HGH within Prescott-Russell. That was on hold with the pandemic. So I have board approval to continue moving forward in terms of building HGH within our region. That the only piece that I will add, right, so it's not that it's going to go back to the drawing board, but the thing that's changed from 3 years ago is the fact that surgical centers, and you've probably seen in the news, surgical centers are the next piece that Mr. Ford will be investing in, right? And it's something that when I was at TOH, I was at the Ottawa Hospital, I was developing with the surgeons, and it's something coming to HGH that I want to develop even before the Mr. Ford's announcement. And that again goes to why, if you need day surgery, why would you have to drive to Ottawa, park, wait 3 hours. You shouldn't have to do that if you're able to get it closer to home. And these surgical centers are built, right, to not be in hospitals, right? So again, if you require day surgery, they don't need to be done in hospitals. But then if let's say we do your workup with the specialist and then you have some diabetes, you have some outlying factors, you may be at risk for an admission. Well, it's very easy. Then your case is then transferred to HGH because there's a risk that you get admitted. And then instead of getting, the case done, let's say in this case in Castleman, well then, because you live closer to Castleman, well then at that point you'd be transferred to Hawkesbury to do your surgery, and then you would get care there. Your family would come visit for $4 in parking instead of $14.50, and then you'd probably get better care doing it that way, right? So for me at this point, again, I didn't come with some slides. The first phase would be in Castleman just because we've worked on those plans from 5 years ago, right? And the plans are there. It'd be a revamp, right? There are already some pieces where I think strategically we need to go to Clarence Rockland in terms of, and again, I'm looking forward to a conversation with you in terms of what your needs are. But definitely from a needs assessment, when we had done that in terms of doing a heat map in terms of what the services are there, definitely what we see is some type of a need for some type of an urgent care center / mental health pieces in there based on our assessment, but it doesn't mean that jives with your assessment as well. But for us would be, down the road, and again, I know that there's other municipalities and towns and things like that within Prescott-Russell, but for us would be really taking the model and really having an expanded HGH within Prescott-Russell, right? That has very, very close ties with tertiary care in Ottawa, so that we can have your contingency, your members and citizens well taken care of. So for me, at this point, I'm not going to put anything on screen, right? You must know that when we had costed it out, let's say for the hub in Castleman, it was $23 million, right? If I add inflation, stuff like that, it's probably roughly around $30 million. I did mention the hospital, has a big share of that, and we're in a good financial position to put, a decent amount in there. It will require private, it will require public, and that's why I'm here, because as we look at that in Castleman, as we look at that in Clarence Rockland, and other projects that the mayors may have, which I'm sure you do, right? Then at that point, it can only be done if the 7 of you are united behind the vision. And if If for whatever reason you're not, then at that point, the chance of it getting funded from a provincial standpoint, it goes down dramatically. And without a portion of it being provincially funded, especially with the hot pieces that are being funded right now, it makes the project a lot harder to achieve. Right? So at this point, I'm not coming here for asking for money. I'm coming here to really look at, sort of a high-level endorsement from the 7 mayors saying, you know what, like, we can buy into this vision. Please come back to us with a plan. And yes, please talk to, the agencies that you talked to before. I'd like to sit down with you and add my plan. That's what I'm asking for today, is sort of that high-level support from the 7 mayors. So, Monsieur le Président, ça c'est plutôt la présentation à haut niveau. Puis je vous redonne la parole, puis s'il y a des questions ou des commentaires.
Merci beaucoup, M. Beauchemin. Belle présentation, puis assez claire. J'imagine qu'on a tout compris que c'est important pour notre population, puis certaines places de nos régions. Monsieur Zant avait une question.
Merci, Monsieur le Président. En passant, merci beaucoup. On est 8 en passant. You kept saying the 7 mayors, but we're 8 mayors. I just wanted to let you know.
Why do I think 7?
I don't know.
Can't count?
I'm like going, all right, now we're 8. But
The president is a mayor, so.
that's okay. It's okay. I just wanted to correct you just in
Do I
case.
use that excuse? I'll use that excuse, right?
That would work. Listen, I wanted to thank you. It's almost like you were following me during the campaign trail, because every single house that I spoke to said, especially in Clarence-Rockland, we are in desperate need of urgent care. And I think your vision, which I completely buy into, is, I guess, a vision that is for the 21st century, in the sense of saying, you can't just have a hospital somewhere and just keep building and expect everyone to go there. We're going to have to break out into, as you were saying, things that are high priority, such as mental health, cancer care, those kinds of things, within the communities, rather than expect everyone to keep traveling. And obviously, I'm not going to hold up the council today and yourself, but I do look forward to having conversations with you, because we have a lot of ideas, we have a lot of pressure. My question to you on this, and it's, like I said, I love the vision, but staff continues to be an issue. How, and I know the province is starting to now try to poach from other provinces for healthcare. Is that something that you see being an issue with your vision of having something, let's say, in Castleman and Clarence-Rockland?
Yeah, if I can answer the question. So I think very good question, right? Because I would say all the other CEOs in the province are scared of these surgical centers because it's going to take staff from their hospitals, right? I live in a real world where people don't want to work in hospitals, right? Because through the pandemic, we put all of our staff in harm's way, that most staff they're burnt. Right, so the ideas of surgical centers, the ideas of urgent care centers is something that is 21st century, right? The other thing as well is that, having worked at the Ottawa Hospital, I can tell you right now that, and having many services, I can say that many of my staff lived in Rockland, many of my staff lived in Castleman, many of my staff lived in Embrun and Russell, right? So the staff are driving into Ottawa. Right, so it's not us competing against Ottawa, but it's us looking at, when we do our, working closer to home, people want to work closer to home. But people don't want to leave their benefits, their hoop benefits, right? So for us, when we look at expansion and we look at the numbers, I really feel that, and if I look at HGH, 60% of our employees right now, live in Prescott-Russell, but right now where we're not tapping into, right, is the west side of Prescott-Russell. Why? Because they all work in Ottawa. So that's one. The second piece, because I know there's a follow-up, is that right now the big push is international recruitment, right? So if your communities, municipalities, towns, cities, are interested in expansion, right? For us, the international recruitment and then setting up, places where these families can be supported, because as you know, in certain countries, it's not just recruiting the healthcare worker, it's recruiting the husband that does, a certain type of work, it's the kids, it's the schools, it's a whole infrastructure there. That is the future of healthcare in terms of international recruitment, right? So I think for me, the numbers, you have a lot. If I take Clarence-Rockland, there's a lot of people in Clarence-Rockland that work at Montfort, there's a lot of people in Clarence-Rockland that work at TOH.
Merci, Monsieur le Président. My follow-up is simply to say thank you, and please call me this afternoon. So that works. We're in a hurry.
Monsieur Leroux.
Merci beaucoup, Monsieur le Président. Thank you very much for the presentation. You're making reference to previous plans. Before I say, yes, I'm on board, I'd like to obviously see those previous plans. I don't think I was here at the time when those were really looked at. obviously, I understand you guys have been working for a project in Castleman, which is fantastic. That being said, my municipality, the amount of growth is the size of Castleman. So my residents would be asking, why are we not getting this in my municipality versus a smaller municipality? Obviously, I need to see the plan to answer that, right? For us, you're right. My residents are going to Ottawa, or they're going to Winchester, which is, not that far off for us. But there is definitely a shortage of services in our area, and that's something the municipality is actually looking at on how to attract more medical services in our community. So definitely looking to have, after you talk to him, then come talk to me.
Merci, M. Leroux. Any other questions or comments? Monsieur Lefebvre?
Merci, M. le Président. Puis, bonjour. On a eu la chance de se parler il n'y a pas longtemps, puis merci pour votre présentation. Thank you very much. I agree wholeheartedly with your vision, because it is an issue. Family physicians we don't have. A lot of people are waiting, and it's if I can echo the comments of my colleagues here, basically, we're completely behind what you're doing. I also like to ask you to think about volunteerism, because that's a big part of a community. And since the hospital is in the town of Hawkesbury, and I've been a volunteer for many, many years, palliative services has always been an issue or a concern this area. So I think it's very important that part basically be considered, because I did do 10 years of palliative services at the hospital and a lot of fundraising activities, and we want to support the hospital absolutely. So if you can keep that in mind, we appreciate it. Thank you. Merci.
Merci, M. Lefebvre. M. Beauchemin, tout ce que je peux vous dire, c'est que probablement que le Conseil a hâte de vous revoir la prochaine fois avec un plan plus concret, puis avec des chiffres. Ça va être bien intéressant, puis merci beaucoup encore pour la présentation. Je pense que Prescott-Russell semble avoir un plus beau avenir qui s'en vient, puis grâce à vous, puis l'hôpital, puis les docteurs tout en place, les employés, l'importance de notre santé est dans vos mains. Donc, merci encore.
Merci.
Donc, on s'en va à la suite. Item numéro 5, sujet des membres du Conseil. 5.1, Francis Brière, participation par voie électronique aux réunions du Conseil. Je ne sais pas si M. Brière veut expliquer, mais je pense que ça semble être assez clair. Il veut faire de la télé avec le Prescott-Russell.
Non, je pense que c'est pas mal, c'est vraiment pour le procedural bylaw, juste changer le fait qu'on peut participer virtuellement aux rencontres si au besoin. Je sais que nous autres, à la Nation, c'est quelque chose qui fonctionne très bien. Des fois, on a des situations où c'est qu'il faut caller un meeting très vite, et souvent, ça a un sujet ou deux. On fait ça virtuellement. Tout le monde reste chez eux, connecte avec un code sur Zoom ou Teams, et à ce moment-là, c'est fait. C'est tout posté en ligne. Les gens peuvent suivre YouTube. Donc, je pense que la pandémie a démontré un besoin de progresser dans cette direction-là. Fait que je pense que ça va être bon pour tout le monde.
Merci, M. Brière. Commentaire, M. Zant.
Merci, M. le Président, membre du Conseil. Je pense qu'on avait déjà dit qu'on allait reviser quand même le règlement de procédure concernant plusieurs choses, comme les réunions, consent items, des choses comme ça. Puis, moi, je pense que le Parlement canadien vient juste d'avoir une motion où ils ont fait un poll pour dire la majorité des membres parlementaires étaient en faveur d'avoir un hybrid model, même au Parlement. Alors, je pense qu'il va falloir se pencher à peut-être ouvrir les portes. C'est un peu difficile de dire que certains membres y ont le droit et d'autres n'ont pas le droit. Alors, puis on comprend aussi que dans certains d'entre nous, donc moi et M. Brière, travaillent des emplois à plein temps et souvent prennent des journées de congé pour venir ici, pour faire le travail important qu'on a à faire. Alors, moi, I'm open to whatever the council wants to do. I'm hoping that we understand that it's a different time and we've got to be open to different possibilities. Merci.
Merci, M. Zant. M. Leroux.
Merci, Monsieur le Président. I believe in certain circumstances, definitely. I mean, we've seen it where we have a special meeting that lasts 15, 20 minutes and, it takes me an hour almost to drive here. So, if we could have done it virtually, I think, in certain circumstances, I'm not sure we want to put that through for every meeting. I think that there has to be some limitations, but I'm open to investigating the different concepts.
Merci, M. Leroux. M. Lefebvre.
Oui, merci, M. le Président. Je suis entièrement d'accord. Présentement, notre règlement de procédure à la ville de Hawkesbury permet ça pendant le temps de la pandémie. So we do have meetings, and as I agree with you, sometimes you have an emergency meeting. You don't want to travel a large distance for 15 minutes. In the municipality like the town of Hawkesbury, it's not an issue, basically. It's important that as much as we can, though, we attend meetings because there's a certain dynamics of being present, either before meetings, as sometimes we do have discussions, not necessarily with a quorum, but we do have interaction. Exactly. That's why I qualified my response. But the idea is there's a certain dynamics involved when having basically meetings we attend. But I understand the traveling distance. I don't have an issue, but I agree with my colleagues that we need to address it because it has become a new way of doing business. And thank you, M. Président.
Merci, M. Lefebvre. Autre commentaire? S'il n'y a pas personne d'autre, M. Zant.
It also saves the corporation money, right? So we're not paying mileage every time we actually come here. Obviously, it's not going to make a huge impact at the end of the year, but it is a more reasonable way to do it as well. So.
Merci, M. Zant. Moi, mon commentaire, moi le mettre pareil là de l'avant parce que je suis un vœu de la vieille. On s'est fait élire, on a fait du porte-à-porte, on a cabalé. L'acte de présence à la table du conseil démontre un comportement corporel à nos autres membres qui siègent sur le comité. La distance, pour certains, je comprends. Je ne suis pas fermé à l'idée que si c'est une réunion spéciale, que ça va durer 10 minutes. Ça serait dommage de voyager 2 heures, aller-retour, 1 heure retourner. Donc, sur certains critères, oui, j'ai pas d'objection. On attendra les directives de l'administration, voir comment est-ce qu'ils pourraient nous proposer quelque chose, mais pas 12 meetings puis 12 présences par virtuel. Là. Je pense que l'acte de présence a compté. Puis l'importance, c'est en personne le quorum. Il faudra s'informer, si on est correct même par virtuel. OK. C'est mon commentaire. Monsieur Parisien, excusez.
Monsieur le Président, membre du Conseil, nous, on va se conformer à ce que le Conseil désire de nous. Ma question, c'est plutôt vers Mme Cadieux, parce que c'est elle qui fait la gestion de ça. Donc, Mme Cadieux, est-ce qu'on devrait revenir avec des options ou est-ce que le Conseil devrait nous dire ce qu'ils veulent exactement?
C'est vraiment au Conseil de nous donner des directives.
C'est ce que je croyais, M. le Président. Donc, si vous me dites, écoutez, nous autres, là, vous allez devoir vous entendre, parce qu'autrement, je vais vous arriver avec 25 000. Je ne vais pas non plus arriver avec un paquet de conditions. Donc, si vous nous dites ce que vous voulez, nous autres, on va modeler le règlement de procédure pour permettre les réunions, exemple, virtuelles pour une spéciale ou un événement. Parce que des fois, là, c'est pas une réunion spéciale, c'est une circonstance qui est exceptionnelle pour le maire. Ce n'est pas nécessairement le sujet et non pas la date, mais plutôt la circonstance. Il se peut qu'à un moment donné, je vais juste prendre l'exemple à un moment donné de M. Brière, si vous me permettez. On avait un dossier assez chaud à traiter, puis finalement, on n'a pas été obligé de traiter du dossier, mais M. Brière était dans sa période d'examen, donc ne pouvait pas se présenter à la réunion du Conseil. Donc, c'est un vote important. Donc, ça peut arriver. Donc, c'est vraiment au Conseil de nous dire ce que vous voulez. Nous, on va le modeler et l'ajuster selon votre directive. Si vous voulez avoir une couple de semaines pour y penser, en discuter à nouveau dans 2 semaines, on pourra, parce que je pense pas que c'est un sujet qui urge. Je pense qu'il faut le faire comme il faut. Donc, peut-être de nous donner vos commentaires au cours des 2 prochaines réunions, puis on pourra modeler quelque chose pour l'adopter plus tard ce printemps, quelque chose comme ça.
Semble être un plan. Merci, M. Parisien. M. Zant?
Merci, M. le Président. Je pense que, est-ce que ça va prendre longtemps à refaire tout le règlement de procédure comme qu'on voulait refaire? Parce que it's a complete sweep through, so it's not just a one-off. if that's going to take some time, moi, j'aurais pas de problème de dire, for committee of the holes, maybe do we allow someone to come in on virtual, but for regular meetings, we require everyone to be here. I don't know if that's something that would be doable, temporary until le règlement is done.
Merci, M. Zan. Peut-être qu'on pourrait rajouter les special meetings aussi. Madame Cadieux?
Qu'est-ce qu'on peut faire, étant donné que la révision complète d'un règlement de procédure, c'est quand même un exercice extensif à faire? Qu'est-ce qu'on peut faire? C'est qu'à une prochaine rencontre, on peut peut-être pointer les changements urgents qui doivent être faits. On peut faire des modifications, puis la révision complète du règlement peut être faite en parallèle. Donc, définitivement, on peut ramener ça à un plénier. Puis je peux peut-être faire une liste des détails qu'on devrait changer en priorité, si ça vous intéresse.
Merci, Mme Cadieux. M. Leroux?
Merci, Monsieur le Président. Je pense, si on décide de regarder les règles de procédure au complet dans un mois, ça donne les membres du Conseil un mois pour faire notre propre vision, envoyer nos commentaires à la greffière pour dire « Here's where I think changes should be made in the procedural bylaws as a whole. » And then we can go from there. I don't think, correct me if I'm wrong, Maire Brière, but were you looking for an immediate change or within the next couple of months that would be acceptable?
No immediate change. I think it was just progress in allowing us to, like Monsieur Parisien was saying, special circumstances or from administration, even as a mayor, to allow us that latitude that, I need to be, for example, recently we had a counselor that was on vacation. He wanted to participate while he was in Bahamas. He was on Zoom with us. He was participating. He was asking questions. He was engaged. It works. It works for us, and I don't see why it would not work for us here. Yeah. Not forcing any change. I understand that we're steeped in tradition here, and Monsieur Riepel, I totally agree. It's not to get out of coming here at all. It's just if something comes up, we have the latitude that we can still participate and be part of the meeting.
Merci, M. Brière. M. Parisien?
Monsieur le Président, membre du Conseil, il y a des changements technologiques à faire. On va commencer à travailler là-dessus immédiatement. Parce qu'on a une caméra qui est située à votre extrême droite là, pour permettre la diffusion ou la participation des gens du public. Mais au niveau des membres du Conseil, on va devoir avoir une configuration différente. Donc, on va commencer à travailler là-dessus immédiatement. Parce que notre règlement permet, en fait, les virtuels dans une urgence, madame?
En cas de maladie ou de pandémie.
C'est ça.
OK, merci beaucoup. Donc, on est tous d'accord que ça va revenir dans temps et lieu et ça sera...
Monsieur le Président, ce qu'on fait, nous autres, c'est qu'on va attendre votre directive. Là. On va commencer.
So, ma suggestion, c'est que ça revienne au mois de mars. Puis ça nous donne un mois pour donner nos commentaires pour discussion au mois de mars.
Tout faire, proposé par M. Leroux, appuyé de Mme Lajoie.
Puis comme Monsieur le Président, comme mentionné par Mme Cadieux, s'il y a des choses qui doivent être faites immédiatement avant la refonte complète du règlement, on va pouvoir cibler ces choses-là puis les faire tout de suite.
OK. Donc, proposeur, appuyeur, tous en faveur? Contre? Adopté. Merci beaucoup. Item numéro 6, sujet des chefs de département, 6.1, Stéphane Parisien, 6.1.1, service de répartition des incendies avec la ville de Hawkesbury. Monsieur Parisien.
Oui, Monsieur le Président, membre du Conseil, comme je l'ai mentionné, l'entente de service de répartition pour les 7 partenaires avec la Corporation de la ville de Hawkesbury vient à échéance ce 28 février 2023. Donc, le DG de la Corporation de la ville de Hawkesbury ainsi que moi avons eu des discussions pour prolonger l'entente actuelle moyennant certains frais dont les trésoriers ont discuté cette semaine. Et donc, on va proposer la prolongation de l'entente actuelle pour une période de 2 ans pour nous permettre de négocier le potentiel d'une entente à plus long terme. Donc, je pense que ce qui est important à ce stade-ci, c'est de pas d'avoir d'interruption de service, pas non plus d'avoir de discussion par rapport à qui dit quoi et donc avoir des problèmes de bris de contrat. On veut continuer dans cette veine-là. On est de bonne foi de 2 côtés. Donc, on va amener le règlement à la fin du mois pour prolonger l'entente actuelle pour 2 ans.
Merci beaucoup. Est-ce qu'il y a des questions, commentaires? Pas d'action à prendre, ça va revenir à la fin du mois. Parfait. Merci beaucoup. Item numéro 6.1.2, Bois-et-S, demande de subvention pour le rétablissement des forêts. On a tous une lettre d'attachement demandant la subvention concernant la lettre. Ça me prend une directive de la table du Conseil. Monsieur Leroux.
Merci, Monsieur le Président. Je veux dire, j'ai fait beaucoup de commentaires dans le passé. Again, I come back to this is private properties. My understanding is even the Ontario Woodlot Association hasn't made demands of government. We have a lot of priorities. We have I have concerns about affordable housing in my municipality, about lack of healthcare system, about lack of daycare spaces. These I find are more a priority than helping private woodlot owners, which, by the way, we already subsidize. We subsidize at 75% at the municipal level in regards to taxation. So we've already been giving woodlot owners a discount on taxes by 75%. Now, did they take that money aside and put it aside in case something happens to help them in such a situation? I don't know. That's up to them to do what they do with their discount. But I feel that, because there's a lack at the federal and the provincial level, we should not be picking up the slack. Because if we pick up the slack, we will be picking up the slack on everything going forward. And we know there's challenges at the provincial and federal level. And it's only going to get worse. So, moi, j'ai bien la misère avec ça. That being said, I do know that South Nation has applied for a federal grant for $1 million specifically to help in this situation. So, we're pushing for that. We've done what we can as a table here to push the provincial and federal government, and we should continue sending letters and advocating for the residents in our communities. But giving funds at this level, I have an issue with. So I would not recommend that we move forward with this request of $75,000.
Merci, M. Leroux. Any other comments? Autres commentaires? M. Zant?
Juste un commentaire, Monsieur le Président. Merci que la municipalité Clarence-Rockland a mandaté d'approuver le 75 000.
M. Lefebvre?
Oui, merci, Monsieur le Président. I'm just going to make a comment, and it relates to a reporting that was done by CBC and a situation that happened July the 24th, where camping sites, campgrounds, and they have the same issues, basically, in the sense that there's no federal or provincial monies available, and the municipalities is always asked to pick up the tab. And I'll just read some certain comments in the reporting. It says here, basically, that they tried to obtain even a meeting with the ministry, and they were denied and refused. So we're the group, the Woodland Group, is not the only basically persons who are affected by this. You have camping sites, and you have one mayor saying that there often municipalities are damage left behind, and often more than municipalities can take on, and we cannot take on every situation. So it's very difficult, and I agree with Mr. Leroux in the sense that we have to make and continue to make presentation and representation at the provincial and or federal level. We cannot be the sole source all the time. Thank you.
Merci, Monsieur Lefebvre. Madame Lajoie.
Thank you, Mr. President. I think as a county, we do need to continue to put pressure on the province and the federal government to have more of an aligned view moving forward. I know the federal government has the 30 by 30 program where they want to conserve 30% of our land, and then we have the provincial program where we're having less access to conservation authorities. We need to help support our environment, but I think giving this money will set a difficult precedent to follow. That's just my comment.
Thank you, Mme Lajoie. Any other comments? Questions? At this time, we'll need une directive. J'ai besoin d'une directive du Conseil. On a déjà une proposition, un genre de mandat de M. Leroux de dire qu'il ne supporte pas la demande. M. Lefebvre a quand même dit les mêmes choses, mais concernant un campground. Mme Lajoie est sur la même veine. Donc, ce que je vois, c'est que le Conseil s'en va sur le côté qu'on ne supporte pas la demande de Boisés. Est-ce que c'est... Ça me prend un proposeur, un appuyeur, qu'on s'en va dans cette direction. M. Laviolette propose de ne pas supporter la demande de Boisés de 75 000 $. Est-ce que j'ai un appuyeur? M. Leroux. Question, discussion? Je sais qu'on a discuté, mais c'est important à ce point-ci de... Vous avez une question, vous, Mme Lajoie?
Thank you, Mr. President. Just a comment. I think we need to add in that we're going to continue to put pressure on the province, provincially and federally.
OK. Monsieur Laviolette, vous voulez mentionner quelque chose?
Bien, je vais dans le même sens de Mme Lajoie. Écoutez, on n'est pas ici pour, je pense, aider les privés dans nos décisions. Je suis d'accord qu'on supporte, puis qu'on envoie des lettres, puis qu'on continue à essayer d'avoir quelque chose, soit de la province ou du fédéral. Mais je ne pense pas que c'est notre mandat, puis on ne va pas créer de précédent non plus, commencer à sortir des argents pour tous et chacun. Notre conseil, nous autres, n'a pas supporté. Bien, il n'y a pas eu de motion qui a été faite pour supporter les 75 000 $. Mais par contre, on avait déjà envoyé des lettres, on avait déjà envoyé ici au comté, puis à la province, puis même au premier ministre, puis au ministère. Fait que oui, c'est pour ça que je propose la décision.
Merci, M. Laviolette. M. Leroux.
Merci, M. le Président. Non, j'ai fait mes commentaires. Le seul commentaire que j'aimerais ajouter, c'est que après la discussion, la présentation qu'on a eue la dernière fois, I was expecting something in the letter to specify that the landowners were going to, take up a percentage of that. And, it didn't seem like the landowners were willing to put any money forward in this case, and I found that was a little disappointing. But again, public funds on private property, we go down that route and never going to finish.
Je suis en faveur. M. Parisien avant.
Monsieur le Président, membre du Conseil, j'ai des discussions régulières avec notre député, M. Sarrazin, pour lui demander s'il y a quelque chose that's coming down the pipe. On me dit que possiblement, ces discussions-là ont été partagées aussi avec M. Saint-Pierre, qui est ici aujourd'hui. Moi, j'ai eu des entretiens avec lui également. Donc, on espère toujours qu'il va y avoir quelque chose qui va venir du provincial. Donc, je vous laisse ça comme commentaire de ma part.
Merci, M. Parisien. Donc, la résolution est à la table. On a proposé un appuyeur. Ceux en faveur? Ceux qui sont contre? Adopté. We're going to go to our next subject, 6.2, Louis Prévost, 6.2.1, Draft Report UF-001-2023, Implication of Bill 23 on the Management of Consent and Subdivision Plan Files. Vous avez un attachment, you have an attachment, you've all read it all, so if there's any question, Mr. Prévost would be more than happy to answer your questions. Oops, M. Lefebvre.
Oui, merci, M. le Président, et bonjour, M. Prévost. Merci pour votre rapport. J'ai juste un commentaire ou peut-être une explication que vous pouvez me donner. C'est plutôt à la deuxième page du document Information générale et analyse. Et je vais juste lire le texte. Le projet de loi 23 adopté par la province l'automne dernier a plusieurs incidents auprès des municipalités en Ontario. Le but ultime est d'éliminer le plus possible toute barrière administrative qui pourrait retarder et bien ralentir l'objectif de construire 1,5 million, etc. En lisant votre rapport, je ne vois pas où on enlève des barrières. Peut-être que vous pouvez m'expliquer un petit peu où j'ai manqué un petit peu dans votre rapport. Merci.
Merci, Monsieur le Président. Monsieur Lefebvre. En fait, il y a des bonnes choses avec le projet de loi 23 là, à travers la province. Puis je l'ai dit souvent dans le passé qu'au niveau du planning, il y a un Ontario urbain puis un Ontario rural. Tous ces changements-là sont plus axés vers les grandes agglomérations comme Toronto, Ottawa, des choses comme ça. Mais là-dedans, il y a des choses qui nous affectent directement, notamment les municipalités locales directement avec les frais de redevance que, dans certaines occasions, vous n'aurez plus le droit de collecter, des choses comme ça. Mais au niveau des comtés, c'est l'habilité d'avoir un contrat de service avec des agences de conservation de la Nation Sud pour faire la révision de certaines études. Ça, même si on n'a pas la conservation de la Nation Sud pour faire ça, on a besoin de quelqu'un pour le faire. Parce qu'on ne peut pas juste tout simplement abandonner ça. Donc, nous, il faut se revirer de bord puis trouver quelqu'un. Donc, les gens... Ce qui se traduit avec ça, c'est que les gens vont continuer à avoir une révision, vont continuer à payer, puis probablement plus cher, puis prendre plus de temps. On a quand même un besoin de le faire. Donc, oui, le projet de loi 23 élimine beaucoup de barrières, mais il élimine pas toutes. Puis ça ne règle pas tout le problème. Donc, c'est pour ça que l'ébauche du rapport que je vous présente aujourd'hui, c'est une solution à court terme, puis également à long terme pour pallier à ce manque-là qui est créé avec le projet de loi 23. En espérant qu'éventuellement que la province va peut-être changer son fusil d'épaule puis permettre aux municipalités qui le souhaitent d'avoir des ententes de service avec des agences comme ça. De cette façon-là, on reviendrait avant ce qu'on était.
Merci, M. Prévost, parce que j'ai pu constater ça, que cette phrase-là, puis qu'est-ce que vous proposez, c'était en réalité une façon de dire que faut continuer selon le plan directeur, le plan officiel. Nous n'avons pas le choix et il nous manque un outil. Alors, vous allez nous revenir pour trouver un consultant pour être capable de remplir ce manque qui se trouve en relation avec ce projet de loi, cette ligne-là qui se trouve dans le projet de loi.
Oui.
Merci.
Merci, M. Lefebvre, M. Prévost. Autre commentaire? Recommandation, dans votre lettre ou dans votre ébauche, il y a option et recommandation. Donc, il y a 3 points. C'est ce que vous proposez au Conseil?
Monsieur le Président, membre du Conseil, oui, c'est exactement. Je cherche une directive parce qu'il y a des dérogations du Conseil qui sont nécessaires justement pour l'embauche d'un consultant à court terme sans passer à travers un processus de soumission pour une période de 6 mois. Également, il va y avoir des frais supplémentaires de 50 000 qu'on anticipe, qui ne sont pas au budget, mais qui vont être récupérés par les frais de révision qu'on va charger. Mais il faut quand même que ça prenne l'accord du Conseil pour ajouter sur budget à la prochaine révision. Puis, comme c'est bien mentionné, là, moi, je vous ai présenté un ébauche du rapport pour le finaliser pour qu'il soit présenté de façon formelle là, à la fin du mois.
Donc, est-ce que j'aurais un proposeur, un appuyeur pour adopter ce que M. Prévost recommande? Mme Lajoie, appuyé de M. Laviolette. Tous en faveur? Ceux qui sont contre, adopté. Merci, M. Prévost.
Merci.
Prochain item, 6.3, Éric Larocque, Agrément Canada, résidence Prescott-Russell. Encore là, on a un attachement. Beau sommaire, bien accrédité. Monsieur Larocque, commentaire suivi de cette belle lettre.
Bien sûr. Donc, Monsieur le Président, membre du Conseil, j'ai une très bonne nouvelle de la résidence Prescott-Russell ce matin. Du 6 au 8 décembre 2023, nous avons reçu des visiteurs d'Agrément Canada, qui est un organisme qui établit les normes pour assurer la qualité et la sécurité des soins de santé qui procède à l'agrément d'établissements de santé au Canada et dans le monde entier. Dans le cadre de ce programme, la résidence a été soumise à un processus d'évaluation rigoureux pour rencontrer les normes d'excellence. Les différents départements de la corporation qui collaborent étroitement avec la résidence ont aussi été évalués à cette étape. Donc, au terme du processus, Agrément Canada conclut que la résidence Prescott-Russell et les comtés unis de Prescott-Russell surpassent les exigences du programme Quantum et excellent en matière d'amélioration de la qualité et de ses services. Donc, la note décernée est agréée avec mention d'honneur. Cette note indique que nous avons atteint le plus haut niveau des résultats possibles et fait preuve d'excellence dans son conformité aux exigences du programme d'agrément. Il est évident que je suis heureux de cet accomplissement et extrêmement reconnaissant envers l'ensemble des membres du personnel de la résidence. Ils ont su promouvoir et maintenir une culture et un environnement permettant à nos résidents et nos résidentes de bénéficier d'une qualité de soins inégalée et d'un milieu de vie dépassant les normes les plus exigeantes de l'industrie. Donc, Monsieur le Président, membres du Conseil, vous venez de dire, je vous ai partagé le sommaire. Si vous avez des questions ou commentaires, je suis disponible.
Questions, commentaires? Si je peux rajouter mon petit grain de sel, comme on dit. Monsieur Larocque, félicitations. À vous, mais pas juste à vous, au personnel de la résidence Prescott-Russell, considérant les défis auxquels les résidents ont été confrontés pendant la pandémie et tous les sacrifices que le personnel a dû faire pour assurer le bien-être de nos résidents et de nos résidentes. Je suis fier personnellement et au nom du Conseil de constater le niveau d'excellence et de notre établissement de soins de longue durée. Donc, félicitations, puis grandement mérité. Merci beaucoup. Suivant cette élocution, on s'en va à l'item numéro 7 à huis clos. Ça va me prendre un proposeur, un appuyeur, proposé par M. Zant, appuyé de M. Lefebvre. All those in favor, ceux en faveur, ceux qui sont contre, adopté. On se revoit dans De retour du huis clos, on va passer à l'item numéro 8, ajournement. Après un proposeur et un appuyeur pour fermer cette réunion. Madame Lajoie, appuyée de M. Kirby. All those in favor? Ceux en faveur? Ceux contre? D'adopter. Merci beaucoup. Bonne journée et on se revoit le 22 février à la réunion du Conseil mensuel.